I'm Kenneth Sartwell.
And I'm Colby Nelson. Today we're going to be discussing contraceptive uses worldwide. We're going to talk about two contraceptive uses today, the first being female sterilization and condoms.
Alright, female sterilization is most widely used in developing countries at the moment. What happens in female sterilization is that they block the fallopian tube. Of course, in doing that, you need to consult your physician. You're going to have a surgeon involved if you have the surgical procedure, and that's known as a tubal ligation. In this procedure, the tubes are cut, sealed, and tied, which to most people is known as getting your tubes tied. The non-surgical is having a small spring, it's like a coil placed in the fallopian tube. This will cause scarring and it won't let the sperm implant. Sometimes mutilation happens in developing countries, and that's the most inhumane form of it. It's most effective of all contraceptive use, but it is irreversible for the most part. Sometimes a tubal reversal can occur. There's about a 33% chance it will be successful. You just need to have patient education before the procedure to let the patient know that they may not be able to have kids in the future. You may want to call and consult your partner to see if that would be something that y'all want to think about in the future. Also, educate on possible complications like infection, post hemorrhage, and that's about all.
Okay, and the second contraceptive technique we want to talk about today is condoms. And condoms on a rise in developed countries and developing countries. There's all kind of different kinds of condoms. Here's one for an example right here. It's just a plain Jane Trojan latex condom. Condoms are made out of different things. You know, you can have condoms made out of latex. You know, they can be made out of lamb skin, lamb intestines. They can be made out of polyurethane, just all kinds of different things. Condoms are very inexpensive, and they're very, very, they're very effective. Condoms, they protect you against a number of things, from all kind of STDs, AIDS, HIV, gonorrhea, syphilis, chlamydia. They protect you against unwanted pregnancy. They're very effective. Have a very effective use. One of the biggest things to know about a condom is that a condom needs to be the right size. It needs to be the right condom for you, and that you really need to educate the patient or the person you're talking to about the kind of condom that they need to use. And the way to use a condom properly. Most people don't use condoms properly. Most people aren't even aware that there are different kinds of condoms. You can have condoms that have spermicide in them, which kill sperm on contact. Condoms come in different girths. They come in different lengths. So that's one of the main educational points that you need to make to a person is to find a condom that fits them. They need to find a condom that has not only the right length but the right girth. And there's been a 2% failure rate in condom use for the first year. But we're seeing more and more now that the rate goes up after the first year. And why there's a failure rate within the first year just really befuddles me, because it says on the back of the pack how to use the thing. But be sure to always educate. If your patient or the person you're talking to has any kind of latex allergy, you want to go with something different. You probably want to go with one of your lambskin condoms or polyurethane condoms or something like that. They're very effective. They're very inexpensive. You can go to the health department. They'll give them to you. Most doctors' offices have them. They'd be glad to give them to you for free. And it's one sure way not to get an unwanted STD or to get somebody pregnant that you wouldn't want to.
All done.